minus 30 seconds. T minus 20 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
A very good morning to all the dignitaries and participants. Warm welcome to all of you. It gives me an immense pleasure to start this auspicious session by extending a warm welcome to all. It is a great privilege to welcome all the participants today for our webinar session. We are proud to announce that this webinar is being conducted along with the cooperation of Social and Preventive Medicine Department of Government Medical College, Kurnool. Stay home, stay safe is the best caption for this COVID-19 pandemic. Home is the safest place to prevent from infection during this period. Isolation represents one of the several measures that can be taken to implement in infection control and the prevention of communicable diseases from being transmitted from one person to other person. Isolation is most commonly used when a patient is known as contagious. Now we shall invite speakers of this session. Now I welcome all the eminent speakers and guests from different platforms for this program. Now I invite Honorable and beloved Principal, Professor Dr. B. Valli Madam, Principal, Government College of Nursing, Kurnool, and Madam, please come to the dais. A warm welcome to you, Madam. I request Mrs. D. Dhanalakshmi Madam to present bouquet to our Principal Madam. Now I invite our Honorable Chief Guest of today's webinar, Professor Dr. A. Sridevi Madam, Vice Principal, Government Medical College, Kurnool. We heartily welcome to you, Madam. Now I request Mrs. S. Krishna Kumari Madam to greet our Chief Guest Madam with bouquet. Now I invite respected Dr. T. Shivakala Madam Garu, Assistant Professor, Department of Social and Preventive Medicine, onto the dais. We welcome you, Madam. Now I request Mrs. M. Radhamma Madam to present bouquet to Dr. Shivakala Madam. I invite respected Mrs. D. Dhanalakshmi Madam, Assistant Professor, Head of the Department of Community Health Department, Government College of Nursing, Kurnool, onto the dais. Mrs. T. Bhavani Madam, please present the bouquet to the Mrs. Dhanalakshmi Madam. Let us begin with this webinar by seeking blessings of the Almighty with a prayer. Now I invite Mrs. U. Veda Purnima, second year student of MSc Nursing, to sing a prayer song.
Ya kundendu तुषारहारधवलां या शुभ्रवस्त्रान्वितां या वीणा वरदण्डमण्डितकरां या भगवती देवी तां नमोऽस्तु ते।
Thank you, Ms. Veda Purnima. Let's give head start to the webinar. Light symbolizes brightness and prosperity. It removes the forces of darkness and gives us positivity. I would like to invite the following dignitaries. Please step forward for the lighting of the lamp. I invite all the dignitaries on the dais to perform lighting of the lamp. Dr. S. Sridevi Madam, Vice Principal, Government Medical College, Kurnool. Dr. B. Valli Madam, Principal, Government College of Nursing, Kurnool. Dr. T. Shivakala Madam and Mrs. D. Dhanalakshmi Madam. Thank you, Madam. Dr. A. Sridevi Madam, Dr. B. Valli Madam, Dr. T. Shivakala Madam, and Mrs. D. Dhanalakshmi Madam. Thank you, Madam, for lighting the lamp. Now it's time for unveiling the theme of our webinar. Unveiling the theme of our webinar by our beloved Principal Madam, Mrs. Dr. B. Valli Madam. Our Principal Madam is unveiling the theme of our webinar. Yes, okay.
Good morning to all. Yeah, we have unveiled the theme of the seminar. Yes, we welcome you all for the webinar on COVID-19 and role of the community health nurse in home care management. And we wish good morning to all. we welcome for the webinar on COVID-19 role of the community health nurse in home care management. The theme of the webinar is COVID-19 and role of the community health nurse in home care management. It's my privilege to unveil the theme and make our community health nursing department of Government College of Nursing, Kurnool, to have a very good learning session with our speakers, Dr. Sridevi Madam and also Shivakala Madam from the Kurnool Medical College Community Health Department, Community Medicine Department. We are privileged to have other learning sessions. All the best to all the participants who are logging on this, and we'll have a good day. Thank you very much. Next slide, Sridhi. This one.
Okay, very good morning to all of you. Audible unda leda ella telustundi audience study. Okay. మార్చారు. ఇది కూడా పనిచేస్తుందా? I welcome all the participants of the webinar. Myself, Dr. Sridevi. I'll be presenting COVID-19 role of community health nursing in home care management. I appreciate all of you for choosing this noble profession and for providing dedicated services. And I thank the organizers for giving me this opportunity. Dr. Dhanlakshmi, Dr. Radhamma, Dr. Krishnaveni and Dr. Bhavani, I thank them. So we'll be discussing about introduction to COVID-19. So what is COVID-19? It's an acronym. It stands for coronavirus disease of 2019 caused by novel coronavirus of SARS-CoV-2. The name was given by WHO in February 11, 2020, and it's a newly emergent virus. So none of us are resistant to this. So all of us are susceptible to this disease without vaccination. Okay? And on 11th March 2020, WHO declared it as a public health emergency of international concern. On electron microscope, it measures about 60 to 40 diameters. It's a single stranded RNA, contains spikes, with petal-shaped or club-shaped spikes, and it is similar to SARS or MERS, but distinct from them. Okay? And it's effectively inactivated by lipid solvents like chlorine-containing disinfectants. And coming to problem statement. Emma? Okay, nice. So So it was first started in Wuhan. There were clustering of cases, that is case series. There were 27 pneumonia cases of unknown etiology were reported in Wuhan province of China. Okay, in December 31st, 2019, and the virus was detected as a causative agent on January 9, 2020. Okay, and disease was named as COVID-19 by WHO. And on January 20th, the disease was spread to 3 countries out of China. So it was first spread to Thailand, Japan, and Korea. And by the end of April 2020, it was almost spread to 212 countries and union territories. The first case in India was reported from Kerala, and first death was reported from Karnataka. So in the month of December 2020, new strains were reported from UK and South Africa. So this is alpha and this is beta, and and on 11th March 2020, this disease was declared as public health emergency of international concern by WHO. So on 16th January 2021, first vaccination drive started in India. The vaccines available in India licensed for vaccination are Covishield and Covaxin. So what is a global scenario? So as of February 19th, 11.08 crores cases and 24 lakh deaths were reported. And the United States reported highest number of cases, followed by India as of May 2021. And cases are increasing in Southeast Asia, and cases are plateauing in Americas, Europe, Africa, and Western Pacific. And cases are decreasing in Eastern Mediterranean. Okay. So as of May 2021, highest number of cases were reported from US, around 3.27 crores, 3.27 crore cases and 5.81 lakh deaths, followed by India, 2.26 crore cases and 2.46 lakhs deaths. Okay, and the case fatality is least in India. It is only 1.1%, and deaths per 1 lakh population is also less in India, 18.01 per 1 lakh population. It's highest in these are arranged in descending order. First Belgium, then Italy. So India accounts for 46% of global cases and 25% of global deaths. And India accounts for more than 90% of both cases and deaths in Southeast Asia region. On 2nd April 2020, Arogya Setu app was launched. It's a location-based surveillance app. It tells us whether the person is in the community is is at risk of infection or not. And worst affected states during second wave are Maharashtra, Delhi, Karnataka, Kerala, Tamil Nadu, and Andhra Pradesh. So highest number of cases were detected in the month of May, April-May during 2021, and highest number of deaths also were reported. So 3.26 crore cases. So it can be spread by direct and indirect transmission. Okay. So direct transmission, when the person coughs or sneezes or talks, the droplets droplets are depending on the size. If the droplets are less than 5 microns in size, okay, they'll directly impinge on the susceptible person's face. So it will impinge on the conjunctiva, nasal mucosa, oral mucosa of the susceptible person. Okay, and if the droplets are of more than 5 microns in size, 5 to 10 microns, they'll fall on the floor, or they settle in the on the surfaces like furniture, walls, okay, table, etc. And the potentiality of spread increases with close proximity, overcrowding, and lack of ventilation. So what are the measures? So controlling the reservoir or the source of infection. Okay. So the difference between reservoir and source. And the source only disseminates the infection. There is no multiplication in the source. So how do we control the reservoir and the source? So the reservoir is either a case or a carrier. So by isolation and quarantine of the infected person, okay, we can control the reservoir. So how do we control the so what is isolation? Okay, separating the infected person. Okay, separating the case during the communicable period. And quarantine is separating the contacts of the case during the period of maximum incubation period. Okay. Then what is the interrupting modes of transmission? Interrupting modes of transmission is by disinfecting all the surfaces which are exposed to infectious agent, and protecting the susceptible host is by vaccinating persons and also by providing personal protective equipment like using mask and PPE kits, etc. And especially protecting the susceptible population. And how do you reduce exposure to susceptible host? It's by social distancing and also by using personal protective equipment. So how does social distancing help? So with the distance of 1 meter or more, okay, the chance of spreading from person to person, that is direct transmission, can be reduced. So droplets falling on the impinging on the conjunctiva and oral nasal mucosa and skin of the susceptible person, the chances will reduce. So cleaning the surfaces, so mopping the floor and using 1% sodium hypochlorite solution. Clean and wash linen with bleach solution. Bleach solution is prepared by adding 8 grams of bleaching powder, that is 7 to 10 grams in 1 liter of water. So after cleaning with detergent, it has to be disinfected with the bleach solution. And it has to be, the waste must be categorized separately and disposed of, and it should be labeled as COVID-19. So what is the communicable period? So period during which the infection can be transmitted from a reservoir to the susceptible host. So it starts 1 to 3 days prior to symptoms. Okay. So during pre-symptomatic phase itself, okay, then it starts transmitting the disease, and until the duration of RT-PCR positivity. So in case of asymptomatics, okay, RT-PCR can become negative at the end of 2 weeks, whereas in moderate symptomatics, it may take 3 weeks or more. Okay, and quarantine has to be, the period of quarantine should be maximum incubation period. It is up to 14 days. What are the clinical features? So clinical features can be specific or non-specific. Specific to respiratory illness like fever associated with running nose, cough, shortness of breath, okay, and sore throat, etc. And non-specific symptoms like body pains, okay, diarrhea, loss of taste and smell. So clinical spectrum can range from uncomplicated illness to critical illness. critical illness including ARDS, sepsis, and septic shock. Okay, the disease severity, almost 80% have uncomplicated or mild illness, and 14 to 50% will have moderate illness requiring oxygen therapy, and only 5% require intensive care unit treatment, ICU treatment, with severe cases. Only 5% are severe. Okay, who are the persons at risk? So elderly, those with comorbid conditions, those with immunocompromised individuals are at risk. So persons with ARI are fever associated with specific respiratory symptoms like running nose, cough, sore throat, etc. And with some other non-specific symptoms like loss of smell, loss of taste, diarrhea, body pains, okay, extreme fatigability, etc. And so these are for those with symptoms of ARI or influenza-like illness, they are advised for either home isolation or COVID care centers. And so if they develop difficulty in breathing, dyspnea or shortness of breath, okay, and persistent pain or pressure in the chest, or altered sensorium with increased confusion and cyanosis, extreme fatigue, okay, these are the signs of SARI, severe acute respiratory illness. So they must be transferred to district healthcare centers or COVID hospitals. So who are the high-risk contacts? All the healthcare personnel and those who are directly come in contact with the COVID positive case are high-risk, high contact risk. Next, coming to high-risk conditions. So which are the high-risk conditions? So above 60 years of age and comorbid conditions like heart disease, congenital heart disease, congestive heart failure, coronary artery disease, and lung diseases like bronchial asthma, COPD, chronic bronchitis, emphysema, tuberculosis, occupational lung diseases like silicosis, and people that require home oxygen, diabetes mellitus, and hypertension. Okay, and immunocompromised individuals. Seeing a doctor for cancer and treatment such as chemotherapy or radiation. Those who are undergoing chemotherapy or radiation and received organ transplantation or bone marrow transplantation and taking high doses of corticosteroids or other immunosuppressant medications, are persons with HIV or AIDS. Okay, so and then persons with blood disorders like sickle cell disease or who are on blood thinners and treatment for CKD, chronic kidney disease or chronic liver disease, lung disease, etc. Okay. These are risk factors. So they are more prone for severe disease and mortality is also high among them. We should be very careful with these persons. So if we have time, we'll come back to diagnosis later. So RT-PCR is the gold standard, and we also have CB0, TRU0, etc. So these will detect E gene. Okay, E gene is for detecting E gene is advised for screening, and other genes advised for confirmatory test. Okay, by detecting viral antigens, antibodies, and other biochemical markers. So how do we categorize? We categorize them as mild, moderate, and severe disease based on the oxygen saturation. If the oxygen saturation level is more than 94 and the respiratory rate is less than 24, we consider it as mild, based on the mild symptoms like fever and other respiratory symptoms. And we consider moderate if the oxygen saturation is 91 to 94 and respiratory rate is 24 to 30. Okay, and severe disease, the oxygen saturation is less than 90% and respiratory rate is more than 30 per minute. Okay, and so Government of India created COVID care centers and district COVID district COVID health centers. Okay, for which moderate disease is advised. Then we have COVID care hospitals. So the persons who are categorized as severe disease, okay, are transferred to COVID hospitals. So for mild disease, persons with mild disease, so if they have facility at home, okay, if they have facility for home isolation, and if they have facility for quarantine at home, okay, quarantining of other family members, okay, then if they have separate room in the house for the case, so the well ventilated room with attached toilet, and then there must be one caregiver. So okay, if the caregiver is available 24 hours, okay, throughout the duration of the isolation period, then it can be allowed. And the patient must download Arogya Setu app, okay, and he has to keep the app active all the time. So what is the purpose of this? So so he has to answer all the questions given in the Arogya Setu app, whether he is suffering from any symptoms at present, or whether he was suffering from symptoms previously and with RT-PCR positivity. So if he was a confirmed case previously or at present, he has to mention it correctly. Okay. Then either himself or the caregiver has to monitor his health condition regularly. Every day he has to check his oxygen saturation, respiratory rate and temperature. Okay. If there is any deviation from normal, then if the condition is deteriorating, he has to inform to either medical officer or national surveillance officer, district surveillance officer, DSO. Okay. Then, so he has to give in writing that he is willing to be home isolated. We have to take a declaration from him, from the patient. Okay. So if the person is having any comorbid conditions or if he is immunocompromised, then before advising home isolation, proper evaluation must be done by the treating medical officer, whether he is fit for home isolation or not. Okay. So if he is diabetic, we have to check his random blood sugar levels, okay, HbA1c to rule out. So they should be under control. All the comorbid conditions must be under control to advise him for home isolation. And he has to monitor his health status regularly and inform to the health authorities, either district surveillance officer or a telemedicine department. Okay. Or if he wants to, if the condition is deteriorating, he has to inform 104 to get transferred to designated COVID health center. And what instructions we have to give to the patient? Okay. All the time he has to wear triple layer mask. The patient has to wear, and whenever the caregiver enters the room, he has to wear a N95 mask. Okay. Then the patient should not go out of the room, especially if there are any other persons like with comorbidities or children in the family. Then he should not come in contact with them. Okay, and he should not go out of the house. Okay, he should open all the windows and doors, allowing proper cross ventilation. Okay, then there must be a attached toilet. Okay, case himself. Other persons of the family should not use this toilet. Okay. And daily he has to take gargling with mouthwash or inhalation prone position is advised. Daily for few hours has to be in prone position. So, mask should be discarded only after disinfecting it with sodium hypochlorite solution. So, he has to change once in 8 hours. So, he has to maintain his hydration. So, advise him to drink lot of fluids and follow respiratory etiquette. All the time he has to wear mask. Okay, and he should not allow any guests to the house. And he should not attend any functions like marriages, birthday parties, fairs and festivals during this time. And he should not travel anywhere. Okay? And he has to reveal it in the Arogya Setu app. And personal hygiene, including hand washing practices and using sanitizer. Okay. So whenever he touches infected surfaces, he has to wash his hands. And he should not share his personal items like towels, napkins with the other family members. So when these droplets are more than 10 microns in size, they fall on the floor or on the surfaces. So what are the commonly touched surfaces? So commonly touched surfaces are light and fan switches, door knobs, okay, taps, then cord railings, okay, walls, tables, chairs, and the toilet flush, then lift buttons, okay, and walls in the toilet, etc. So we have to disinfect them every day, preferably once in 12 hours. So how do you prepare 1% sodium hypochlorite solution? The required solution is 1% sodium hypochlorite solution. So the available solution is either 5% or 10% cans are available in the market. Okay. Suppose if 10% cans are available, then we have to use 100 ml of solution is added to 900 ml of water. Okay. If the 5% solution is available, then we have to use 200 ml of solution is added to 800 ml of water. Okay. The formula is C1V1 equals C2V2. Okay. So while cleaning this, they have to wear the gloves. And after removing the glove also, they have to clean the hands properly with soap and water. So wet mopping using disinfectant. The floor must be cleaned. So how do you clean the floor? Okay. After cleaning with detergent, again they have to use either bleach solution. So 8 grams of bleaching powder added to 1 liter of water, and bleach solution is prepared every day. And it has to be discarded once in 12 hours and prepare fresh solution. Okay. And this should be done not only for home isolation, for COVID care centers, COVID hospitals, and designated COVID health centers. So whenever the soiled clothes of the patients, soiled with any secretions or discharges from the patient. Okay, so these soiled linen must be washed with detergent, followed by cleaning with bleach solution. So bleach solution after a contact period of 30 minutes, okay, they have to be cleaned and washed. Then how do you dispose the secretions of the patient? Nasopharyngeal secretions or oropharyngeal secretions, okay, or urine, okay. So they should be 5% either with bleach solution can be used, or 5% cresol. 50 ml of 5% cresol is added to 1 liter of water. Then after a contact period of half an hour or 1 hour, after a contact period of half an hour to 1 hour, okay, it should be discarded in drains. And when to seek medical care. So when the patient is in home isolation, okay, the patient himself or the caregiver has to monitor his health. Okay, what is the respiratory rate? Whether he's having any difficulty in breathing. Okay, what is the oxygen saturation? Is it going less than 94%? Okay, is there any persistent pain or pressure in the chest? Is there any altered sensorium or mental confusion or inability to arouse? Okay, is there any seizures or slurred speech? Okay, then fatigability, weakness or numbness of the limbs. Okay, then persistent fever for more than 5 days. Okay, in that case, he has to seek medical attention. Okay, according to doctor's advice, he may be shifted to designated COVID health centers where the oxygen supply is also available. So, what treatment is given? Treatment is given as supportive treatment, symptomatic treatment, and treatment of comorbid conditions. So, supportive treatment include like multivitamins, multiminerals, vitamin C, okay, 100 mg BD, then zinc, B complex. These are given as supportive treatment, and hydrating the patient. You have to maintain hydration, okay, of the patient. Then symptomatic treatment for fever, running nose, cough, etc. We have to give symptomatic treatment, and treating the comorbid conditions. Suppose if he has any hypertension, diabetes, or any other condition, we have to continue the treatment. Okay, and they should be under control. These comorbid conditions must be under control, especially diabetes, because the COVID virus affects the pancreatic beta cells. So continuously he must be in communication with the treating physician and report in case of any deterioration. Suppose if the oxygen saturation falls, or if he develops any dyspnea, okay, then immediately he has to report to either district surveillance officer, okay, or treating medical officer or telemedicine department. Advise him for warm water gargle and steam inhalation. Okay. Then, so advise budesonide spacer, okay, inhalational budesonide spacer in case of if the symptoms persist, well, okay, or become severe. So please don't advise. Remdesivir is not given for mild cases for home isolation. Okay, never administer remdesivir or antiviral medicine, or never give steroids, corticosteroids for home isolation. They're not advised at all. Okay, so give only supportive treatment, symptomatic treatment, okay, and treatment of comorbid conditions. Okay. Then, so suppose during 5th and 7th day of illness, in case of moderate condition, okay, if D-dimer and other enzymes are showing high levels, then we go for corticosteroid. To decide whether to give corticosteroids or tocilizumab, we conduct these investigations. So what measures? Please tell me if it is time. Measures taken by central state government. So measures are taken to reduce in transmission and to control the outbreak, and for behavioral change communication by increasing awareness. So what the government is doing to reduce transmission? Okay. Government advised lockdown from March 25th, 2000, okay, for 55-day lockdown from 25th March 2020 for 55 days, okay, to prevent transmission and advise social distancing. And for behavioral change communication, advise 3 golden rules. So for always wearing mask and frequently washing hands and maintaining social distancing of 6 feet. So these are the protective measures. So in case of international travels, okay, at the entry point, government advise screening of all the travelers, immigrants who are coming to India. So screening for okay, RT-PCR, and then quarantine. If they're negative, then we advise quarantine. Okay. Then if they're positive, we isolate them and then treat them. So for international travelers also, they're checking. Okay, RT-PCR negative report are at the perimeter border, then they're checking the testing and tracing and contact tracing. So they'll find out where they're going, where they're going to stay, okay, and who are the co-passengers, etc. So this is the transmission pattern. So after the imported cases, they infect the family members and it becomes cluster of cases. Then cluster of cases, suppose that is known as local transmission. Okay, so we can easily trace primary and secondary contacts in case of local transmission. Suppose if they transmit to the community, okay, so we'll not know who are the primary and secondary contacts. It becomes very difficult to control the disease. So it happened in second wave. So containment strategy include, this is the clustering of cases, then around that is the containment zone, then perimeter area and buffer zone. So what are the actions taken in the containment zone? So active surveillance, okay, by village health, grassroots level health workers. 50 houses allotted to each grassroots level health worker to identify active cases of influenza-like illness or any person suffering from respiratory symptoms and testing them. Okay. Then passive surveillance. So mapping of all the hospitals, government and private hospitals in the area. So they have to report, okay, all the cases. Suspected cases and confirmed cases have to be reported by passive surveillance. Okay. Then this is the perimeter area and buffer zone. In buffer zone, active surveillance is not done, but all other activities are done, like reducing the mobility of population and passive surveillance, etc., and contact tracing, tracing the primary contacts and secondary contacts, and tracing the source of infection. Okay. Okay. Thank you very much for giving me this opportunity. I thank the organizers for giving me this opportunity. Thank you.
Madam, we have more information about distribution of COVID-19 and guidelines of home isolation and when to seek medical attention and management of COVID-19, waste management and disinfection. Madam, we shall follow all your guidelines. Once again, thank you for your information. We shall move on to the next session.
ఎందుకు మళ్ళీ కష్టపడతారు ఇది కూడా బాగుంది ఇది ఒక వెరైటీ కోల్డ్ టీ కోల్డ్ కాఫీ
our beloved principal madam Professor Dr. B. Valli madam to deliver her address on prevention and infection control of COVID-19 at home. A very good morning to madam. Indeed, it's a great opportunity for me to introduce our beloved dynamic principal Dr. B. Valli madam garu. She has been a source of inspiration to all the students studying here. She has nurtured and molded the careers of many people in this profession. Dr. Valli madam has joined in the government service during May 1985 at Kadapa. Madam has worked as PHN lecturer, assistant professor at various colleges in Andhra Pradesh. She had a splendid career of more than 3.5 decades. During this period, she has set certain benchmarks for the upcoming professionals in this profession. At present, Madam has been working as Principal, Government College of Nursing, Kurnool from December 2020. Within no time, she has got promoted as Deputy Director of Nursing a few days back. He is the highest, it is the highest cadre of nursing, DD of Nursing AP. Madam has completed 36 years of service, both in teaching and non-teaching in the hospital and colleges throughout the Andhra Pradesh. She has reached so many milestones throughout her career. I would like to share a few achievements of her during her career on this occasion. During her career, Madam visited Nottingham University, London, UK, and participated on advanced innovative methods in nursing education and nursing curriculum development. Madam is one of the member of Research and Ethical Committee in NIMS University, Hyderabad, and Dr. NTR University of Health Sciences, Vijayawada. Madam received various academic appreciations and honors and awards. Madam worked as President of TNA of India, AP branch. She has organized various conferences and workshops. With the spark of motivation given by her, this webinar has been organized. She has been a gifted teacher and able administrator. Thank you, Madam. I hand over this session to you, Madam. Please start your session, Madam.
Thank you very much. And we congratulate the Community Health Nursing Department and the HOD Dhanalakshmi Madam for organizing this one. So we thank our Sridevi Madam for giving an elaborate and informative introductory session on today's program. And now I'm going to start. Hope that you had community health and the COVID-19. What is the relation between the both of them? So when we look into the today's theme, as we have been unveiled, role of the community health nurse in home care management. And now I'm going to see that we are going to have the session. Today you are going to have the session mainly on the COVID-19, the community role and all other things. You had a very good introduction to the home isolation, more to be done. And now I welcome you for the we would like to share. ఇది కొంచెం ఇలా చేయమన్నా అంతేనా? Now we welcome you for the session. Yes, once again, a welcome to all of you. And now I am going to take up prevention and control of COVID-19 infection at the home. So mainly today we have been concentrating on the home isolation and what to be done. Majority of the individuals with the COVID-19, you had a introduction that they were being recovered, maximum number of people at home by taking various steps and taking measures. During this process of their recovery, what will happen? COVID-19, the causative organism coronavirus is being spread by various means. So when we know that it is being spread by air, by having a close contact, by moving from one place to another place, we must also give information and make the community and the home also to be ready to take up the measures to prevent the spread of this COVID-19 infection within the home itself, because home is been made up of many individuals, a lively place where the family members where they have a close compassionate. Once the client is been diagnosed as a COVID-19, a positive PTCR, when it is been diagnosed, we should be able to differentiate either the client is been required a home care or maybe mild, moderate, severe, and what is the care that is been required. Depending upon that, we must take the measures. When you look into the client in the home, yes, home is the starting place for the love and hope and the dreams. As per our Mother Teresa, the great person, the leader who made. So make your home a lovely and a dream place where you can have a hope that everybody is safe. When the things comes from the individual, from the home, automatically what will happen? All the families are being together with the community or the society and the country, and in turn the global happiness and the global health can be taken up. So as countries are being introduced to restrict this spread of infection, and they have restricted many movements from one person to another person by having the lockdown and controlling the infected individuals not to move from one place to other place, not to have any huge gatherings or anything. That is the reason today we have been organizing a webinar so that we will stick on to the principles and we will prevent the spread of this COVID-19 infection. When you look into the preventive measures, there have been various preventive measures that are been there. So in these preventive measures, we are having various components. This platform will be making us to have the very few time. So we are going to have that these preventive measures are being, I'm going to discuss, as everybody knows. One is that we are going to have that we are not going to concentrate on the depth of the things. Everybody has a depth knowledge, but the practice is very minimal. So having knowledge is not enough. So we need to practice. So we want to make this session as a very simple, which every individual can practice for prevention of this COVID-19 spread. First is most important, cleanliness. So we remember our great leader and a noble professional in our nursing profession, nothing but lady with the lamp, the Florence Nightingale, the era, the nursing fraternity, everybody will remember her. It is the cleanliness, environmental sanitation that makes the people to have the very keen responsibility of every individual to maintain the cleanliness. Once this cleanliness comes, automatically the environmental sanitation, she proposed a theory where it has been making everybody not to have any disturbance, not to have the spread of the infection. First, you take care of the hygiene. Automatically, the individual personal hygiene and environmental hygiene. And most importantly, in the COVID-19, we heard about SMS. So everybody's hands are always, whether we have food or air or anything, it is the mobile in our hand. That gadgets is there, but not that SMS. SMS stands here is the sanitizing. So sanitizing our hands. See that your hands are being clean by sanitizing yourself. Next, this is most importantly, M stands for the mask. See that everybody wear the mask. And SN makes the safe state, not to have the movement. You are going to see that you will be stick on to the one place, that you are not going to move from any place. You will stay at home. So when we make the COVID-19 positive clients who are with the mild, who are been permitted to be at home, we need to see that their needs are being met. Their care is being taken. The infection, the incubation period, depending upon that, the spread of infection is being curtailed, so that we will be making that. Next, we are going to concentrate on the routine of the individuals, making the individual to recover from that. It is not the COVID-19 which has been there with the disease incubation period of 14 days, or it may be medium of 4 to 5 days, whatever it may be. The spread of infection and individual will be suffering even after the infection also. The impact is there on their physical and psychological status. So they have to make them to be fit physically by having a healthy diet, making their minds very sound, and whatever the remedial measures that are being required with the comorbid conditions, or if you see that they have been having an exposure, following the quarantine principles, whatever the health policies that are been telling us to follow, we need to stick on to that. Coming to the how long one has to be making a quarantine period, that all depends upon the survivability and the virulence of the coronavirus. We know very well that it can survive in the air for 3 hours, on any metallic copper surfaces for the 4 hours, on the cardboard maybe for the 2 days, that's about the 48 hours, stainless steel also respectively 48 hours. The plastic, the nature was been covered by the plastic. We know that even though we impose the rules and regulations, every step we see the plastic that is been covering the greenery and taking the life of ourselves and the every individuals. So that plastic, it also can survive for 3 days. That's about 72 hours. Why should we know? Why the community should know? Because we take the preventive measures, so that we take the safety measures to combat this virus spread. When we look into the first measure of cleanliness and personal protective equipment, we know very well, when you look for the past December 2019 onwards, when you look coronavirus, the person with the mask, with the cap, with all the top to bottom wearing a suit, and with the shoes, having the goggles, that all are what? Nothing but protective equipment, because the healthcare professionals, the doctors, nurses, and all other people who have been coming forward to work, taking care of the COVID positive individuals in the hospital or any other healthcare settings, even at home also, if we require, you need to protect yourself, having coming in contact with the coronavirus or the secretions or anything. One is that protecting the eye and face, maybe using your face shields or the protective goggles that you will do it. Then next is that you will be having all the disinfectants that you will be using, the sanitizers and disinfectants that are been with various things that are been available. Mostly you will go with the single-use things or reuse things. So you must be very clear about things, what you can reuse, what you need to singly dispose. Sometimes we say that single use, but even then if you are not properly discarding, say for example, the masks of this kind, when you are been not properly discarding or anything, what will happen? This may come out as a packed one again. We have seen once the plastic syringes are been came into the thing, it was been many times misuse of the things are been happened. So like that, it may be there with the mask also. One should be very careful. Proper disposal of these personal protective equipment is very important, that you will be taking care. And also when you have been working with the client, expose it to the positive client in the home or in the hospital setting. When you have been wearing and doing the work, once you have been removing, you also should follow certain principle. So in the home care setting, we need to teach the family members or the caregivers or the attenders who have been taking, even the client himself, we have to, or herself, we have to make them to have these principles to be followed. Most importantly, cleaning, see that you will use some effective disinfectants for cleaning. If nothing is there, a flow of water and the soap, we know very well the soap will have the, it decreases the surface tension, and also it makes the tiny oily and fatty substances to dissolve and remove from our contacted surfaces, and it will make us see that you will have a frequent washing of your hands, not that showing a yes, you have to use this sanitizer, you have to promote this, that. It is not like that. Any sanitizer, when the water washing is not possible, you go for that, or you see that a flow of water will be there where you can sanitize your thing, and you will clean and you will rinse properly, so that all your gadgets and all your hands are being clean, and you will be properly disinfecting them as per the principles, as per the item and the things that are been coming in contact with the individuals, and individuals are been using that. And most importantly, in the COVID-19 prevention, we told that not only just cleaning and having contact with the surfaces and taking care of our things, and having, when you go out, when you come inside the home, that you will wash up, see that all the things are being wear, and complete total bath you must take, so that the organism, the virus that is been coming in contact. Usually the Indian culture is such a great heritage culture that the people, when they go out and other thing, they won't walk in with the shoes or with the chappals or anything. They leave them outside and they will come. And olden days, we see that they will give a mug of water for them to wash their legs and leave their dirt. That means minimizing the dirt and the organisms entry into the home environment is very, very important. So, manam kottaga emaina, if we are telling anything new to the individuals, what will happen? Oh, something they are telling, they are taking a mic and telling. It is not something that is new. It is what your culture is being told, what you are being civilized, that you have been practicing. Because of the westernized culture and advanced these things, we forget all those things. And in this pandemic time, we have to re-emphasize that one. So after the cleaning, it is the activity of the body. Body needs an active exercises. So when the person is in the home isolation, I think the next speaker, Dhanalakshmi and other madam, Sivakala madam may be making you to understand how much impact on the mental status of the individual, what a nursing person or a healthcare provider has to do at home. They may be making you to have a clear understanding. So I will emphasize on the exercise. Every day you see that you will try to move. Not though we say you have to be inside the room, don't come, I'll give the food, I'll give the water, I'll give everything. But the person's status of the mind, you have to look. We mean to tell them, move in the room freely. See that the doors and windows are been opened so that you will have a cross ventilation. Listen to the music, whatever the type of music, whatever you want. You do whatever the thing. So dancing to the music, it is not that if you dance only will recover. It's not like that. Enjoy. Make your diversion of the mind. See that whatever the games, whatever the indoor games, outdoor games, reading newspaper, chatting in the cell, or watching the TV, whatever is that, we want something to be done and some movement. So you need to walk maybe up and down according to your health status, according to your oxygen level. The individual need to monitor all the vital signs and there especially the oxygen saturation levels and because in a early stage itself, the hypoxia need to be identified and they need to be moved. Yes, so we need to make them to be very active. Meeting their daily activities will make them to be very active. That makes that activity should not be in the positive state. They should not mingle with other family members. They should be done within the room which has been provided for them to have the home isolation. See that the diet has been supplied to the individuals or the person has been preparing within their house itself by itself. It should be clean. It should be separated from all the dirt and other thing. Fresh vegetables, it should be cooked thoroughly. Though they have been taking raw foods and other things, they can minimize little bit until the digestive system and other things are been coming to the normal. As far as possible, avoid some packed and preserved food that are been there and see that the foods that are been safely preserved and they were being used in a balanced way. To make the food to be very attractive for the person, a variety of foods and adding some additives or things, making the food to be very attractive according to their immunity levels, to boost their immunity. The balanced diet and protein diet and vitamin diet need to be given. The fruits will take a good place in the diet that may be incorporated according to their economic level, according to their feasibility and availability. Not to say that if you eat the fruit, if you eat the dry fruits, who will buy the dry fruits? It's very costly. From where the person will get? We say that whatever the foods that you are eating, the greens that gives plenty of minerals and vitamins. So we have to make them to that. And the next is that making the individuals to have a plenty of water. It's a part of preventive measure, the primary and secondary and tertiary preventive measure. See that the person takes up an adequate water so that the viruses that are being there, the excretory system and the dehydration, the signs and symptoms the person will experience are being taken care symptomatically, makes the liver and the kidneys to be very clear and removes all the elements from the individuals. Mostly the persons will limit themselves. Okay, that should not be there and reduce intake of carbohydrates or sugars, especially the clients with the diabetic mellitus and all other thing. We know very well before handling any vegetables or anything, when you buy from outside and bringing into the home and dumping into the fridge. Why I'm telling dumping? Because we say the lockdown, non-availability, all will be put. So the freshness will go up and what they are eating, maybe sometimes it is been starting with a little bit of fungus and other growths that are been there in the vegetables and the fruits. So we need to take care because some or other way, the immunity level of the COVID-19 positive clients will be altered and the person may be getting infection. So we need to make them to be very thorough and taking care of themselves with the thing. And if they have any habit of alcohol or smoking or anything, or taking drugs or addiction to some of the additives or substances, we need to emphasize them that avoiding such things or keeping them away from the individual for a complete recovery when they are at home. Not that only for a period of time, see that their behavior and attitude towards them will be changed and slowly they will come to the normal. And there are certain tips for the person. If they are chronic smokers or heavy smokers, we have to emphasize them at home when they are being there. trying to divert on something else, taking a deep breath, drinking some water, or using some other replacement substances so that they can come out of this smoking, not at a time, or meditating themselves to have a mental health and making them to be very comfortable with them. So talking to the friends and visiting them, all can be done when they are becoming negative, and when it is been permitting and when it is been needed only, not unnecessarily. Oh, 14 days I am inside the home, I did not meet anyone, now my COVID test is negative, I can move anywhere. It is not like that. Yes, the organism still will be there in the body and you will be taking care. So tell them to be having a peace of mind and meditating and preventing their movement. When they prevent their movement, automatically the spread of infection can be prevented. Yes, and as per the home remedy measures, if it is mild with the pyrexia, antipyretics, yes, Dolo may be prescribed. If they have any allergic symptoms of cold or anything, maybe citrizens, whatever may be the ICMR guidelines and the health department and the state government has given the guidelines, home management kit will be given to them. Nowadays, the telemedicine and 104 and 108, the home isolation numbers are been available. The persons, the volunteers and the healthcare team is been making calls to the positive clients and asking them whether they have taken the drugs, are they all right, what happened to them, is there any requirement is been required at the home. And sometimes if they require within a week or bi-weekly, the medical person also will be visiting if there is any comorbidity. We have seen in the past 1 year that when the beds are been not shortage of hospital occupancy and all are been there, the medical team itself, mobile team is to go there and meet their oxygen needs and other medical and other needs of the health needs of the individual. So ask them to have those things and let them have a piece of rest and sleep. This rest and sleep makes their booster their immunity and makes the person to have a good health, so that they will be free from the thing. And if they are been with geriatric clients or aged individuals, see that they have any underlying cardiovascular conditions, respiratory conditions, or any other things that they were being there with the diabetes or anything, see that they will be avoiding the crowded areas or the places where you might interact with the people. All those things, ask them to be very strict on. And especially when the COVID positive clients at home, when they are being present, a positive client and also geriatric patients, if possible, the client may be moved to a home quarantine place or maybe a quarantine areas, because to take care of the geriatric clients in the home is also very important. So both they need to balance and see that which is the priority we can do the counseling for the family members. And sometimes majority of the family members, they'll say it at home, 6-7 members we are been there, aged people are there, let me go to the quarantine area. The government is provided, the centers are been there, I can be recovered there and I'll come back to that. And some of them, they feel stigmatized. Oh, what the people will think. I don't want to go like that. In such cases, you need to counsel them, whichever is best for preventing the spread of infection and safeguarding the geriatric clients is also we need to take care of them. And take care of the healthy and all the underlying conditions of the older and aged people also, mostly the pregnant women and also a newborn babies who are been there, they should be taken care. And we know from the January of 2021 onwards, the vaccination drive by the government has been made. The clients were been, geriatric clients were been vaccinated fast, and later on 60 and 45 to 60 people were been vaccinated. Now below 45 people are also started vaccinating the vaccine, and the research is been making to have the vaccination even for the pregnant and the postnatal mothers. We may see some more things may come out. So we need to take this information to all the people that they will take care of their comorbid medical underlying conditions regularly, whatever the diet, the medications that they were been taking, and their life processes will be continued, though they were been suffering with the COVID positive and they were been recovering. And this way we need to give the information at the home. Protecting others from the sick is also very important. Cough hygiene. When they cough, most of the time we will be keeping the hands like that. See that they will not keep like that. They will be coughing by turning the head and keeping the elbow, and they will be coughing, and whatever the covering the tissues and that they were been using, they will be properly discarding into the or handkerchiefs, whatever it may be, throwing them very closed containers and washing their hands. That's very, very important. Coughing or sneezing, I did not touch anything, Kada. It should not be like that. We must look into it before going to the sick person. You are clean, your hands are being clean, you are protected very well with a mask and all other thing. Then you will enter into the place if it is been required. Yeah, otherwise we can make the person to have the care by themselves. And even the Arogya Setu app is also made the persons to be remaining active, and wherever they move also it will be known, available, and it will be giving information where you are been there, whatever the level of care that you've been required, you can contact the people. And we told that the caregivers and all the closed contacts should be taken care to avoid the COVID-19 vaccination as per the physician orders and all other things and advices. It has been going on in the things, and we were been taking care of the things. Okay, so vaccination, whatever the type of vaccination that are been available, prevention, we could able to eradicate the polio or the smallpox or anything from the world. That means the countries and every individual and every healthcare professionals are been taken a drive, taken a preventive control measures, and they can able to control. In the same way for this coronavirus also, the vaccination is been going on, and we need to cooperate with that and motivate the public and make them, though there are certain side effects, we will be focusing on more of that. So we need to curtail and we need to condemn certain things, take the proper advices, whatever the myths that they are having, false ideas they are having, that we need to control them and give them that facts. Yes, what is the fact exactly, what is the truth behind it, and let them take the vaccination and prevent their getting contact with the infection and all other things. And see that you will maintain your distance, minimum 2 meters or maximum whatever the distance is available, whatever the need is there, only you will be moving, otherwise you will not be moving from one to other place. Though we wanted to meet our day-to-day survival needs and all other things, lockdown between 1 or 2 hours, the curfew was been relaxed, everybody coming into the thing that they think that they have to come out and take the breath. In the streets, we have to take a breathing. It's not like that. That is only needed things that to meet, needed things to get. That was been there. But sometimes we have seen this mob will be coming out, and again there will be curtailing and down, decreasing of the cases. The prevalence of that, the diseases have been coming out, the incident. Again, suddenly it has been increasing. These are all been happening because the people are being moving. Keep a distance when you are being there. Limit the number of people gathering also. Even our public gatherings in the community also, they have limited for marriages, birthdays, or any occasions also. Permitted, they need to take the permissions. And even the legally, they have imposed certain rules and regulations also. So, but even then, some violations are been going on. Whatever it may be, they see that they will take the precautions and they prevent the spread of this infection. Yes, home care for the people with the suspected or confirmed COVID-19, when you are been looking, ensure that the ill person will take an adequate rest. Yeah, they drink plenty of fluids and they eat, take the diet and other thing, and they fast and should most, they wear the mask, the 3-layered protective mask, and the person who is giving care or giving the food also they will be taking. When the person is not able to get out of the bed, only will be going nearer. Otherwise, you can provide that the doorstep of the individual, the person can take all the thing. Frequently washing your hands either with alcohol rub or water, whatever it may be. When you come in contact with the person or any articles that are coming in contact with the persons, you have to disinfect them. And you see that whenever you require, you need to call to the medical person, ill person, whatever the difficulties, experiences that the person has been having, the warning signs that are been there, that you need to make them to be taking care online. They need not come and they need not contaminate themselves. Yes, these are once you are been at home, whatever the clothes that are been coming in, the bed linen, towels, the things that are been there, the things that are been handled, they should not be mixed with the other family members' things, and they should be put separately in a bucket or in a tub or whatever the facilities, the soil linen, the dirty linen, they should be kept separate and they should be taken care, and they should be taken care if possible. Any disinfectants, they can use them, or if nothing is there, properly washed with adequate soap or whatever the cleaning powders and laundered, and they will be dried in the sunlight and they may be reused, whatever it may be. And patients should use a triple-layered mask when they are been in contact or anything. They must stay in a identified room, and that room should be a well-ventilated room so that the person will have a cross ventilation and will have a peace of mind, and it should be a pleasant. They should not feel that it's an imprisonment or they have put in a jail or like that. They should feel that it's a pleasant environment for their recovery and for their family, for other members to protect, and see that you avoid sharing of or anything. Or maybe if the place is not there, we told that the positive patient may be moved away from the family and they may be kept in a quarantine rooms or a care COVID care centers or whatever it may be. Otherwise, you should not allow them to share the bed or the room as far as possible. Do not share any personal articles or anything that are been there. Wear the mask that is been properly covered. This is the one that is been, every individual is been doing what we say, the wrong steps in wearing the mask. The mask is been out and the nose will be peeped out, or it may be the nostrils are been out, or the mask is been touched by your hands and contaminated thing getting adjusted. It should not be. It should be properly wear, and we need to educate them whenever we have been wearing a mask. It's see that the handles are been used and it should be properly covered and it should be adjusted. Yes, the knob it should be. And when you are touching also, when you are removing also, you should remove from this, and you should not that there are certain wrong methods that they will be using. They will be adjusting with the hand and other thing that we must educate them. In the family, when you educate, automatically everybody will be knowing, and properly every 8 hours they have been continuously using in the healthcare setting or at home. They should change, and they must discard properly, and they must wash or sanitize, and they must be using. Yes. Then see that friction makes the individual to have a good removal of the organisms with the alcohol based or with the soap or the sanitizer or whatever it may be. The gloves should be, if you have been wearing the gloves for any contaminated articles, when you have been wearing the disposable, it should be properly discarded. An individual, any waste disposable bag should be placed in the patient room so that the person will not come out. The infected material will not be spread with the general people, and it should be packed properly in a closed container. And waste, we know that dry waste, wet waste like that in the families, they'll have all the closed bags, disposable bags. And once you have been handling the dirty bags or anything, it should be properly discarded. And the waste disposable bags also will be closed by them only. That means the client who have been putting all the things, they must be removed from the patient's room and replaced with a new bag. They will be keeping at the doorsteps, and you will be wearing the gloves, and you will be wearing the mask and removing them, and every day like that. Sometimes in certain places we have seen for 7 to 14 days also they will be dumped. That should not be. The environment for the person who is a positive person in the room should also be a clean environment. So there should be a provision for the proper removal and proper washing and all other things. See that you will make the home that will be very, very safe for the individuals. Be safe of yourself, and see that you should be a supportive to the individual. When you are been visiting as a community health nurse or a healthcare provider, as a family member or a caretaker, you make sure that the individual is fighting with the virus and will be coming out with the recovery. But at the same time, if you show stigmatization and the stigma and discrimination, the person will have their immunity levels altered because of the depression and other thing. We have seen in the news also, once the person is positive, they don't want to go to the family because they are afraid. They spread the infection to the family members, and many suicidal attempts were been made by the clients who are positive in the past also. So we need to prepare the public. The prevention and control measures are being available, and immunity of the individual helps the people to come out of that. And various measures, if you have been following, we can combat this dreadful pandemic COVID-19, and we can stay safe. So these are certain medical, surgical, aseptic and cleaning principles and measures that we need to take for prevention and spread of the infection. One is most important, the cleaning and sanitizing. Second one, wearing the mask. And other one is staying at one place, not safely staying, not to move and not to interact with many people, and be supportive to the individuals, whatever it may be needed for them at home when they have been requiring, when they are taking care of the things. So prepare the family members, prepare the client himself so that their interactions will be less, and spread of the microorganism and the virus can be curtailed, and we can come out of this and we can succeed. So thank you for your patient listening and staying at home, staying very safe, saving all the individual's life, saving your life, and making a great effort and support to our government and in the world totally. And have a good stay and safe stay. Thank you very much. These are the various measures for the prevention of infection of COVID-19, especially at home. Maybe as a healthcare professional, frontline workers and the nursing students and the nursing fraternity, we have learned how to use the PPE and what measures need to be taken in the hospital. So mostly we emphasize today, and for the home management, what preventive measures can be taken. Thank you very much. Thank you for giving me this opportunity. Thank you one and all. Any questions you can ask me, or at the end of the things you can put in the box. Thank you.
Okay, thank you, madam, for your in-depth explanation about infection control and preventive measures of COVID-19 infection at home. And also you have given given explanation about the importance of healthy diet, healthy habits of yoga, meditation and exercises, and hygiene of hand hygiene and hygiene of fruits and vegetables, and also home remedies and preventive measures of COVID-19. Thank you, madam, once again. Shall move on to the next session. I request Dr. Shivakala madam to start the session on psychological impact of COVID-19, coping with stress, fear and anxiety. I call upon Mrs. N. Dhanlakshmi to introduce Dr. Shivakala madam.
Good afternoon to one and all. Home is a better shelter for all prevention of communicable diseases. I'm introducing Mrs. Dr. T. Shivakala Madam. I'm glad to introduce T. Shivakala Madam, our speaker of this session. Madam completed her primary education at Mailavaram Gurukula Patashala, Kurnool. She finished her MBBS graduation in Government Medical College, Kuppam University. She completed her post-graduation in community medicine at Government Medical College, Kurnool. Madam has joined in government service in 2015 as SR at RIMS Ongole for 9 months service. After that, from 2015 itself, she has come to Government Medical College, Kurnool as assistant professor. Till now, she is continuing her services in SPM Social Preventive Medicine Department. She actively participates in paper presentations in community medicine. She has done 9 publications and in social preventive medicine, both national and international presentations he has given. She has participated in activities of the World Health Day and so many World TB days she has conducted from since 2015 onwards. At present, Madam was working as a nodal officer of telemedicine COVID-19 wing from our Kurnool Medical College. It's very privileged to invite you, Madam. Please, I'm handing over this session to you. Please start this session, Madam. Thank you, ma'am, for giving this opportunity.
Thank you very much for your presentation. Today I am presenting about the psychological impact of COVID-19, how to cope with the stress, fear, anxiety of this present pandemic. The impact of the COVID-19 pandemic on the mental health. This is my topic today. So as the global world is only focused on mostly on the testing, finding a cure, and how to finding the prevention of the transmission, and that this is a new disease. So we are mostly focusing on the testing, how to cure and how to prevent the transmission. But the people are going to psychological problems, many psychological problems in adjusting to the current lifestyles and fear of the disease. So the many articles are reviewing that before pandemic, there is a depression is 15%. It is increasing mostly. It is during the pandemic, now it is very increasing. Anxiety, depression, all the mental illnesses will be increasing. So it is the time to concentrate on the mental health of the people. So there is an increase in the domestic violence, child abuse. All these are different articles are reviewing. So the subject well-being, all this because of as the new disease is coming, there is uncontrolled fear, and it is anxiety, frustration, boredom, and loneliness and significant lifestyle changes and profound adaptations and psychiatric conditions. All these are because of the things. There are the changing the trends. This is the new illness. So there is anxiety disorders which causes the exacerbations of the symptoms of the diagnosed cases. So very mild flu-like symptoms. If they are having also, there is a increasing the anxiety in the present circumstances. They are having the many illness, maybe the COVID itself, like that they are feeling. So it is a panic buying and excessive hoarding of the essential elements, and there is a lockdown. So the loss of jobs effect on the economy, no work, no money, like that the people are facing the many challenges nowadays. So there is a media, news and government. So distance from the of the relatives in the quarantine centers and financial crisis. All these are the new initiatives. So the new problems they are facing. The new realities is the work from the home and temporary unemployment and online classes for the children, lack of the physical contact with the other family members, friends and colleagues. So they are adapting of the new lifestyle changes, maintaining the fear of contacting the virus all the time, worrying about the people close to us who are particularly vulnerable. All are the challenging tasks for nowadays. All these are leads to the anxiety, depression, stress. If this depression, stress, or you are not cope up with this depression, the suicidal tendencies are also very high. So overall, the fear of contacting disease, anger, confusion, frustration, loneliness, depression, insomnia, all these are the mental effects in the child. So most of them are facing this psychological impact, though all of us are facing, but mostly the healthcare professionals, caregivers, then the pregnant mothers, children, newborns, and immunocompromised individuals, elderly are the mostly risk group. So psychological impact on the healthcare professionals. They are facing many new challenges nowadays. So because of the long working hours, without adequate resources, and without adequate protective equipments, dealing with the COVID-19 related stigma, discrimination, and fear for that is the loved one's safety and well-being, and they are having to care of the family members in quarantine. So all these are the challenges faced by the healthcare staff. So all these leads to the depression, anxiety, stress, post-traumatic stress disorders in the healthcare staff. So how to cope? So to mentally health workforce, there is a 5 steps to a mentally healthy workforce. First, show your commitment on the work. Then assess the situation, the work stresses and mental health needs in the workplace. Make an action plan so that you should set the targets and clear the indicators to measure the progress. Then implement and evaluate the plan so that your plan put into an action so that with the clear milestones and targets. Learn and mainstream. So to conduct the regular evaluations so that make the necessary adjustments if at all anything, then the maintain, that is the mainstream your mental health action plan into a clear written policy. These are the 5 steps to cope up. So the workforce, that is the further help how to cope with the frontlines. First, prepare them for the job. Action team leads can take to help frontline workers to cope with the stress during the COVID-19. First, prepare them for the job. So first, adequate training must be provided to all the healthcare staff and who are facing these problems, challenges. So safety precautions, how to take, how to use the proper wearing of the mask, how to use the PPE. So infection protection and control measures, how to dispose the things, all the things. Then the technical training must be given for the latest guidelines and procedures for assessing, training and treating the patients. First, prepare them for the job by giving the adequate training, then protect them on the job. Provide the sufficient kits and protect them from the incidents of the harassments, violence, including the physical as well as legal protection, and protect and uphold their rights. Help them care for themselves by providing with the information on the stress and how to maintain the healthy lifestyle and when to seek further support. You should help them care by themselves. Equip them with the tools and techniques for the self-care and stress management. Then create a healthy work environment by ensuring the appropriate working hours and workload and sufficient breaks between the shifts. Then consider rotating staff between the high stress and low stress tasks. Keep them up to date with the latest technical tools and guidelines. Allow the frontline workers to voice their concern or needs or participate in the decision making in a meaningful way. And be a good role model. Adhere to the health and safety guidelines and practice the healthy coping strategies like taking the work breaks, demonstrating the healthy habits like eating the healthy diet, hydration, and physical activity, avoiding the use of the tobacco, alcohol, and other substances, and maintain a healthy work-life balance, and practice the stress management and relaxation techniques. Encourage the peer support. So, WhatsApp group should be created, and they share the knowledge and provide the basic psychological support through the peer networks, and establish a buddy system that is providing the professional support to the juniors who are not yet known, not that much of expertise in that. Okay, be perspective and supportive. The familiarize yourself with the signs and symptoms of the stress and burnout. Pay extra attention to who have the pre-existing physical and mental health conditions and disabilities. And pay extra attention to who are facing the challenges in their personal lives and those who lack the social support. We should be perspective and supportive to the who are lack of the support and facing the challenges in their lives, and make the services that are available to all the staff, and give feedback and recognition, highlighting their good performance and opportunities to improve, and shows the appreciation for the hard work and small gestures and rewards to go on a long way in the boosting the confidence and staff morale. So after that is the caregivers and children's and younger adults are the more likely to report the symptoms of anxiety and depressive disorders during the COVID-19 pandemic. We should give the special care to the children. How to cope up the stress in the children? First, listen. So listen to children. That is what are the opportunities they are having and what are the problems they are facing. Then comfort them by telling the stories and singing them and playing the games like that. And reassure that the present condition and provide them with the correct information through the valid sources. So listen them and comfort them and reassure them to keep the mental health of the children. Then impact on the elderly mental health. So here the most of the articles are telling that the elderly also having the mental problems. They are facing challenges in the now present pandemic. So regular telephonic counseling sessions to the elderly and healthy contact with the family and relevant and update information giving to the elderly and caring for the general medical and psychological needs and respecting their personal space and dignity. And the pregnant mothers, then the impact on the mental health in the living in isolation and quarantine. So the quarantine persons, that the patient having the stigma of the COVID-19 and the social media is telling the many updating informations and are facing the many challenges. How to cope with the stress, fear and anxiety. Stay up to date with the accurate information about the COVID-19 and follow the safety measures to prevention of the infection. And take breaks from the COVID-19 media when needed. And try a relaxation activity. So eat well, get enough sleep, rest and exercise physically. Eat a balanced diet and home cooked food. Eat fresh fruits after washing. Drink plenty of water and sleep for at least 6 to 8 hours. Then try a relaxation activities. If you are anxious, stressed, slow breathing may be helpful for you. So take the breathing for the slowly for the 3 minutes, 1, 2, 3 like that, and keep it for the few minutes, then exhale by counting 1 to 6. So this is the relaxation technique. Then breathing exercises. They try the relaxation activities like the meditation, enjoying the music, do something whatever you like, then read the books and water the plants, TV, watch the TV, yoga, but limit the time in the online activities. Then practice pranayama. Do an activity you find meaningful every day. How? So first encourage the persons to think of the something they do what they are feeling better. Then make the list of all the things you are grateful and keep yourself busy by doing any online courses. And find time to do an activity you enjoy. You walk, dance, and wishes to do exercises. Whatever the your wishes to do the things which are left behind. Then interaction with the friends in phone or video call. Do something creative, arting, singing, crafting, writing like that. Listen music, radio. So you should establish the daily routine and stick to them daily routine paper. First you should write them and how much time you can spend. So you should daily routine should be planned. Then you should follow that. The minimize your use of alcohol, drugs, caffeine, and nicotine. Help the others to help themselves. So join with the friends by telephone or video call to stretch and dance too. So at the end of each day, you should shortlist the whatever the things that is the your help the others. It will your mental health will be healthy because if you are helping to someone, you feel better. Be realistic about what you can and cannot control. So you should don't think too much about the government, what the government should do, and what the someone should do, what the health worker should do, like that. So you should do. You can control only the things whatever in your hand. Put aside what is outside in your control. So in conclusion, coping with the COVID-19, take the breaks from the news and make time to unwind and set the goals and priorities. Take care of your body and connect with the others and focus on the facts. Thank you everyone for your patience listening.
Okay. Thank you, madam, for your presentation, information, and facts about
Okay, the question is, even after 2 doses of vaccine, if there is no rise in the antibodies, then is the individual safe enough or haven't take the vaccine again? So till now, there is no effective evidence, but the few articles are telling that if there is no antibody raising levels and if there is the person is immunocompromised state, so the 3rd dose may be needed. Okay. Thank you everyone.
Thank you, madam, for your presentation, information, and facts about psychological impact and coping strategies. Now we shall move on to the next session. Now I request Mrs. D. Dhanalakshmi madam to take the session regarding the role of community health nurse in home care management of COVID-19. I call upon Mrs. K. Sridevi to introduce Mrs. D. Dhanalakshmi madam.
Good afternoon, madam. It is my privilege, madam, to introduce this session of webinar. Mrs. Dhanalakshmi madam is working as a assistant professor, HOD of Community Health Nursing Department, College of Nursing, Kurnool. Madam always guides and supports the students and encourage all the student activities, sir. Thank you, madam.
Okay, good morning to everyone. Today's our webinar is on COVID-19, a role of community health nurse at home care management. Thank you everyone for patiently listening, because the eminent speakers has given very nice presentations by Dr. Sridevi Madam Garu, SPM Professor, and Assistant Professor Dr. Shivakala Madam Garu, and our eminent speaker Dr. B. Valli Madam Garu. So those which I want to speak upon them is very less, but so much of topic is covered. But even though as a community health nurse, we have to practice some practices to take care of the families. So today, everyone is facing so many problems due to COVID-19. So the questions will arise that how to face the present problem, and next question it will come how to face the family, and how to take care of the self, and how to give protection to the family and to the self. And then another question that we come to COVID-19 as a challenge. So don't get panic, and everything is going to be all right. Trust God and let Him do work. As a community health nurses, we have a lot of work to do in the community by explaining the people regarding the control and breaking the chain of COVID transmissions. So the nurses, which we are going the frontline workers, the greatest asset and effective healthcare workforce. The unexpected demands of the COVID-19 disease and its exponentially rising incidence that has taken entire world. As we know, there is no doubt that the pandemic has influenced a lot upon the, which had an impact on the clinical practices too. Health is everyone's greatest asset, where in the promotion of health. Being a community health nurses, our main role is promotion of health and prevention of illnesses and evaluating of the sufferings is the biggest commitment which we have to detect the problems and provide the safety to the people by giving giving the community health nursing practices. So the high quality, where we have to provide the high quality respectable treatment and care should be given. And COVID-19 is, as we know that COVID-19 is highly infectious disease that can be spread directly or indirectly from an infection person to a healthy person through eye, nose, mouth via droplet infection produced by coughing and sneezing by droplet physical contact with an infected person, such as shaking the hands. As it was nicely described by Dr. Sridevi Madam in the introduction. So how much particles that will spread in the air like that. So it is very clear. So we will move on to another aspect. And at present, COVID-19 pandemic has given a part of our daily life since 2020. It is important to control the spread of the disease, particularly by using the non-pharmacological strategies such as the quarantine, isolation, and public health education. So health education plays a major role, as we know that the influencing the factor which modifies the behavior of the individuals. So basically, the person is going to be isolated in the home. That means the home quarantine. What it means that when a patient who tests positive and isolate himself or herself at home, following all the precautions and protocols suggested by the medical authorities. So we should not take on our own. So we are having so many myths, but we have to take the suggestions from the medical authorities. Those with mild or moderate symptoms are usually advised to follow the home quarantines. Having a self-isolation facility and caregiver support is crucial to a good recovery. So as we know, though, when we face with the COVID-19, so we faced a lot. So we need a good support with all the family members. So stay at home and stay safe. People with no symptoms should not be able to stay at home if adequately isolated from the others, but this should be confirmed by a doctor. We should not think for some people will have some thoughts that they are having, they are very afraid of COVID-19 and they don't want to reveal everything. But we should have to have a good consultation with the medical authorities. Then if they advise it only, we have to be in the home isolation. So the period which is supposed to be for 14 days. The day from starting to 14 days, it lasts for the 14 days. The quarantine should be, the person should be isolated in the home. And there are the 3 tasks for the contacts. So caregiver also has to have the tasks that the coronavirus has entered your home. As someone living with you might have COVID-19, so have the 3 tasks. First task is help the members who might have COVID-19, and second task is protect yourself at home, protecting yourself and the other members in the family. Then psychosocial counseling is very necessary. So each and every step, each and every task has its own importance to protect ourselves and the caregivers in the family. So main is the preventing of infection. So preventing of infection is nicely Madam has given a nice information. Dr. Valli Madam has given a very nice information regarding that prevention of infection in the home level, and we will move on to another. So basically, first we have to do when we are isolated in the house, the visitors should have a restriction. During the visitors should physically have a distance when they want to come to share them with the friends or in the family, but there should be a restriction. This is very important to break the chain of transmission of disease. So visitors should be restricted. So vaccination is very important to prevent the safety of, it is very safety to have a vaccination. It was also given very nicely by the eminent speakers of previous ones. So at present in community nursing, what COVID-19 during this pandemic, what we have to do? First, as a community health nurse, when we are visiting the community, we are going to provide the healthcare services at their own doorsteps. But these pandemics which we are having, the people are restricted of the visitings, so we have to assess them by the health, each and every group in the family. So first we have to establish a rapport with them, then we have to provide. So how we are going to give a rapport means by having so many telecommunications or with the virtual speakings and or with the virtual presentations or with the contact with the authorities who are having available with the numbers. And then we have to provide the information that about the illness and testing when they are asking. So if we are having a good rapport, they will open up with the problems, then we have to provide a good information related to what they are asking the question. So we should have a good active listening and we should have show the concern towards them, and we have to remove the myths and misconceptions related to COVID-19, and we have to develop the self-esteem to reduce the stigma, especially the people who are having the COVID-19 are facing so much of stigma in the community. So end of this session, we will have a reassurance. So what we have to do, we are separated the do's and don'ts. It was already over, but simply I'm telling that about the in-home isolation. So avoid touching the eyes, nose, face, and wash. So mouth should be washed with unwashed hands. So when we are touching the eyes or nose or face and mouth, so the hand should be washed properly. So if the person is having any sneezing, cough and cold, so first generally what they will do, they will cough directly or they will sneeze. So in order to avoid that, we have to make an education that they have to sneeze and cough either with the elbow or they have to use the handkerchief after coughing and sneezing. The very important thing is disposal of the tissue paper or whether they have used the handkerchief. And washing of hands and face is regularly at intervals with the soap and water. Already we madam has told this one. And the next one is the soap and water are with the 60% of alcohol, and rubs should be used. So when to wash your hands. So after using the toilets, mostly we have to educate the public regarding these precautions. We have to educate them after how to wash your hands, means after using the toilets or before preparing or touching the any foods, after playing with the animals, and after touching the money, after coughing, sneezing or blowing off your nose. So, after that we have to have a good hand wash. And if the person is isolated in the home, the clean area should be with a clean area. Already in introduction, madam has detailedly told about that cleaning of surface areas and the home isolation. And we have to use a separate washroom if it is available in that house. They can be motivated to use that one. And handling of the linen and clothing is, we have to minimize the handling the used clothes, and before that removing or anything washing, they have to use the gloves. Wash hand and clothes with the bedding of hot water temperature. So if we have to make them, it should be the used clothes should be washed with the hot water. And if hot water facility, the washing machines is not available, so we should not expect everything is having the washing machines. So in general, in community, we have to tell them how to soak the clothes, and with hot water, at least they have to use the detergent, and they have to soak it for at least 30 minutes. The clothes should be immersed, and then they can go for the washing. And they have to, if they are wearing the mask, are using the tissue papers, they should be kept in the dustbin. So the dustbin should be kept in the sunlight, and if it should be disposed properly. So when they are staying at the home, avoid the meeting of the visitors at home. In meeting is essential, maintain a distance of 1 meter. So keeping 6 feet of distance between yourself and other when we are out, or when the gatherings is going on in the houses, so it has to be taken. And if the client is isolated in the home, that room should be well ventilated, and we have to motivate them to take plenty of water. Hydration is very important, so at least they have to take 8 to 10 glasses of water. It is very useful. And then they have to be in a rest period for at least 6 to 8 hours. So this rest we have to provide them. And the triage which we are having, the communication with the telecommunications or any electronic medical records to determine the need for the visit. The patient with the symptoms of fever or respiratory tract infections and close contact with the COVID-19 cases were referred to the nearby public health preparedness clinics, and with the appropriate coordination testing centers of COVID-19 to be preferred at public health hospitals or the PHCs. So the person, if they with the telecommunication when we are talking, so we can make them to use of what the government is providing, the facilities that is available to the community people. And with the virtual meetings also, so which confusion, if they are having any they are facing any problems, or they are having any doubts, we should organize the case, so we can go for the discussion with the coordination in the virtual meetings. And virtual outreaches, so community outreach and assorting the activities were suspended during the CB period. A virtual live outreach program for older individuals are conducted by the community partners. Community nurses were invited to deliver the health talk on falls prevention in the Mandarin and the local dialect. It was well received by the audience, the commitment. So when we are giving the health education, we have to tell the tips how to prevent or how to break down the chain of transmission of that COVID-19. So when they want relaxation, in the previous eminent speaker has told how to control the stress, anxiety and fear. So usually we will relax with family members and relatives, friends by doing the phone calls or with the video conferences if needed, or delivering the healthcare community services in the with the tele consultations and with the connectioning. So we have to have a tracing of the information which we are giving. It should be helpful to the information should be very reliable and well represented. So if they are wants to go for any surgeries, elective surgeries like a cataract or any knee replacements, better to postpone them. After COVID, they can go for the surgeries. So monitor your health is very important. If they develop, if in the home isolation also, some people will develop with subside with the medications, or if they develop the fear, cough and breathing difficulties. So immediately they have to contact the nearest healthcare facilities and follow the medical advices rendered by them. So take care your daily prescribed medicines regularly. When the doctors has advised, that should be followed. But don't take self medicines. Why? Because we are having so many myths upon the treatment part. So we should not take our own medicines. We should be under authorization of the medical practitioners. Then for the maintenance of our body, so we should have a proper nutrition and home cooked fish foods only we have to prefer. Don't go for the hotels or any other junk foods. Better to maintain the better nutritive food, then it will give a boost for the immunity. So be active. So to release all the stress, anxiety and worries by meditating and enjoying the music or watching the TV or water plant and read and doing the some more things. And if you are having any problem, if the suggestions is given by the doctors, then we can go for the breathing exercises. That is the simple things we can go do it, and practicing the pranayama, which will give us the good meditation at least for the 20 minutes in a day. Next, don'ts which we should not do in the COVID-19 coronavirus dangers. So a cough and sneeze should not be. So when covered with a flexed elbow or a disposable tissue, that is discarded immediately after use. Most of the people, they will, if we educate like that, then they will do, but they won't practice after sneezing or coughing what they have to do. So immediately they have to dispose that, whether they have used the handkerchiefs or the tissue papers. Then don't go nearby the contacts if you are suffering from fever and cough. Some people, so that's why we are advising them to restrict the visitors and avoid touching your face and nose and mouth. Okay. Then don't share the beds and bed belongings are like utensils, glasses and mobile phones, towels and bedding, etc. till the 14 days. And do not violate the social distancing, even though at present also due to this coronavirus pandemic also some people are violating the rules of social distancing. So no parties, no family time without the precautions. Do not go for weddings and functions, but it is going on. But we have to protect ourselves, protect others from getting the sick. So we should not, all the etiquettes which we have to follow should have a wearing a mask and throwing of a used things in a proper dustbins and having a proper hand hygiene. Then don't give a shake hand or hug to your family members and to the nearest, which we know the transmission of how it will transmit the virus. So do not go to hospital for routine checkups. So you will get a teleconsultation with your doctor, and then you will get advices from them. But don't go to here and there. We will get so many problems with the coronavirus. So preparation at home. So don't go public transport for going the home, and avoiding the. So avoid all the non-essential shopping and travel. Don't go to crowded places like parks, markets and religious places. So don't go out unless it is absolutely essential. So all the, instead of that isolation person, the family members who are giving the care to the caregivers are also take care of themselves by protecting, by wearing a proper mask and using the hand hygiene, and then not going to here and there restriction of their base. So what we are going to see the in family, we are having the total family members, the community health nurse, we are assessing the total family as a unit. So we have to go the antenatal mothers, which the people are very vulnerable group. We have to assess them, the group of antenatal mothers, geriatrics and the children. When we are if the mother is antenatal, so what precautions that they have to take, we have to educate them. If the symptoms are very mild, how to take care of them, or if it is more than what they are facing the very immediate, if they need any immediate treatment, they have to go for the referral system and they have to go to the hospital for their best advisors. So and to the antenatal visits. The next vulnerable group is the geriatric population. So if the geriatric person is with the comorbid conditions or any sufferings, that the danger signs, symptoms that which they are facing immediately, they have to call the 1075 to get to the healthcare facilities. And after the so these are the symptoms which the persons will face, to go for the 1075. And the key points nowadays, we are hearing that the children is also going to be affected. So when the children is having the signs and symptoms of COVID-19, they have to be cared at home and to take care of them with the proper precautions, that even though if the child is above the 2 years of age group, they have to go for the, they have to wear the mask when they are going out, and they have to go the routine immunizations for the child if they are infected with the COVID-19. And if the mother is the postnatal mother, there should not be any restriction, that some protocols they have to follow for the breastfeeding. The healthcare services for the children during the COVID-19 slide is there. So everyone above the age of 2 years, they have to wear the mask in the public. And then if there are issues related to, so madam has explained lately the stigma. So if the primary contacts are, they should not, they have to avoid the contacts with the pet animals also. So don'ts and do's we are already known. So any referral support to the services should be, that is the best, counseling is the best method to provide a proper information to the clients who are suffering with the COVID-19. So the social stigma and discrimination related to the mental health, what madam has told in detail, the discrimination which we are showing by the community should have a social stigma. So then it should be covered with the support of the confidential, safe space and share ones. So what the counselor has to counsel them properly. Then the emotional support should be get by the active listening, that relating the feelings, and we have to listen what they are telling, and we have to place in a role of empathy, and we have to provide a proper support. So breaking the chain is very important to let the coronavirus from us. So we have to take precautions when we are going out, wearing a proper fitting of the mask and hand washing and maintaining the social distance. So with that, we can able to break the chain. Okay, thank you very much.
Thank you, madam, for your explanation in detail about role of community health nurse in home care management. Now we have come to an end of the session. I would like to conclude the session. It has been a wonderful day. Our eminent speakers has explained in detail about the COVID-19 incidents, epidemiology and guidelines of COVID-19 in home isolation, and they shared in-depth knowledge about prevention and control of COVID-19 at home, and all of us were exposed to new dimension of home care management of COVID-19. So far we have learned the impact of COVID-19 on the people, what are the coping strategies of stress, fear, and anxiety, and also explanation about role of community health nurse in home care management. Now, with the permission of the chair, the forum is open for discussion. Participants can ask their doubts. Madam. Now the session is open for questions. Any questions? The participants can ask their doubts. If if the client is got negative report, whether they also having home quarantine for some time. Now we shall move on to the felicitation of the speakers. Conclusion, madam. Concluded, madam. One. It's been a wonderful day. All of us were exposed to new dimensions of home care management of COVID-19. Now, with the permission of the chair, the forum is open for discussion. Participants can ask their doubts. If there are any no doubts, means we shall move on to the felicitation of the speakers. I request chief guest of today's webinar to accept our felicitation. I request our principal madam to felicitate the chief guest with a token of love. Chief guest, Dr. A. Sridevi madam, principal and HOD of Social and Preventive Medicine, Government College of Nursing, Kurnool. Government Medical College, Kurnool. I request our principal madam to felicitate the chief guest with a token of love. Indeed, it's a great honor for all of us to request our principal madam to accept our felicitation, madam. I request our chief guest madam to felicitate our beloved principal madam with a token of love. Dr. A. Sridevi madam. Okay. Okay, madam, I shall repeat that. Okay. Okay. I request our chief guest, Madam Dr. A. Sridevi. I request today's speaker, Dr. Shivakala Madam, to accept our felicitation with a token of love. I request our principal Madam, Dr. B. Valli Madam, to felicitate Shivakala Madam. Okay. It's a great honor for all of us to request our principal Madam to accept our felicitation. I request Dr. A. Sridevi Madam, Chief Guest of our webinar, to felicitate our beloved principal Madam with a token of love.
దీంట్లోనే ఉంది మేడం ఓట్ ఆఫ్ థ్యాంక్స్ చెప్పు చెప్పలేదు అక్కడ ఓట్ ఆఫ్ థ్యాంక్స్ చెప్పమ్మా మేడం ఫెలిసిటేషన్ చేయలేదంటే ఏ మేడం I express my sincere thanks to our beloved principal madam, Dr. D. Valli madam garu, for giving permission and guiding us to conduct this webinar. Also, I express my heartfelt thanks to our madam for giving the webinar on infection prevention and control measures in home care management of COVID-19. Thank you, madam. I express my sincere thanks to today our chief guest, Dr. A. Sridevi Madam Garu, Professor, Department of Community Medicine, Karnool Medical College, for giving a explanative presentation on COVID-19 and home isolation. Thank you, madam. I express my heartfelt thanks to our madam, Dr. T. Shivakala Madam Garu, Community Medicine Assistant Professor, Karnool Medical College, for sharing knowledge about psychological impact of COVID-19, coping with stress, fear, and anxiety. Thank you, madam. Also, I express my sincere thanks to HOD Madam Mrs. Dhanlakshmi Madam Garu for sharing about role of community health nurse in home care management of COVID-19. Thank you, madam. And thank you each and every madam for participating this webinar. And thank you all students for participating and patiently listening this seminar. Heartfelt thanks to one and all. Thank you.
We should close with the national anthem. Let us end this webinar with the national anthem. जनगणमन अधिनायक जय हे भारत भाग्य विधाता पंजाब उत्कल गंगा विंध्य हिमाचल यमुना उच्चल जगति तरंगा तव शुभ नामे गाहे तव शुभ मागे गाहे तव जय जनदायक जय भारत भाग्य विधाता जय जय जय
I appreciate the community health nursing department.
Thank you, ma'am.
So we give a big round of applause and see that it will be more and more. So congratulations, Lakshmi. Yes.
Principal madam.
No, anything can be done by anyone. That is my principle.